In this interview, Dr. Killeen explains the importance of performing calibration, verification, and linearity for all your instruments to identify problems before they can impact patient results. Dr. Killeen and the team of pathologist experts on the instrumentation committee are responsible for the design of several CAP tools available to help further your quality management efforts.
Every day in clinical laboratories, our primary concern is the welfare of our patients, and we are reporting very technical information that is essential for modern healthcare. So we're really concerned, and we're of course equally responsible for the quality of the laboratory results that we produce. If our calibration system is wrong, our patient results are going to be wrong, and that will have negative consequences, or at least the potential for negative consequences for patient care, because physicians trust the labs to produce reliable and accurate results. So calibration verification and linearity are two separate assessments of laboratory performance. Calibration verification is the process of verifying that the calibration settings of an instrument have not changed since the time that the instrument was last calibrated. There is a CMS, CLIA, and CAP requirement that calibration verification is performed at least every 6 months, unless the instrument is calibrated more frequently than that. There are also another list of circumstances under which calibration verification should be performed. So calibration verification allows the lab to feel assured that its results are in fact appropriate according to the calibration settings that they are expecting. If calibration drifts since the time that the instrument was last calibrated, then of course patient results will also be misleading. So calibration verification gives one an idea that the calibration is still good. Linearity is an assessment that an assay, if you plot the assay results that you measure versus the true concentration of the analyte in the samples, there should be a linear relationship between what you're measuring and what the true values are. And the linearity assessment confirms for you that that linear relationship holds at the time you're performing this linearity assessment. The AMR, or the analytical measurement range, is the range of concentrations that an assay can measure without doing any dilution or concentration of the patient sample. So the AMR is a property of the assay and the method that you're running, and over the range of the AMR there should be this linear relationship between what you measure and the true concentration. So there's this intrinsic relationship between linearity and the analytical measurement range. So verifying linearity gives you confidence that your analytical measurement range is still correct. And there is also a requirement to validate the AMR at least every 6 months. The advantages to obtaining the CAPS, calibration verification and linearity products, also known as the CVL products, is that the samples are prepared for you. They cover every analyte, at least all of the major analytes that you would be likely to run in your laboratory. There is peer group comparison that is offered from the college for the calibration verification part of this. And for the linearity assessment, the college does a very rigorous statistical analysis to determine that in fact what you think is a straight line, a linear relationship, actually holds true. The advantage to using the college's materials are that they're pre-made for you. They are designed to cover a wide range of analyte concentrations, and the data analysis is performed for you by the college. So it saves a lot of time. Well, it's critical really across the board. There's no laboratory test that we perform which doesn't have the potential for bad outcomes if the results are incorrect. I mean, that's why we're measuring these things, because they are clinically important. To think of a specific example, however, that recently arose, in the case of vitamin D measurements, it turned out that quite a number of manufacturers' vitamin D assays were miscalibrated when we looked at specimens where we knew what the actual concentration of vitamin D was in that system. And in those instances, it's highly probable that patients were misclassified in terms of did they have normal vitamin D levels or low vitamin D levels, or maybe even high vitamin D levels. And so patients who might have needed treatment for low vitamin D levels were not getting treatment, or patients who didn't need vitamin D treatment were being administered vitamin D. And this is not a totally benign agent. You can have all kinds of medical complications with excessive intake of vitamin D, notably the development of kidney stones. You know, increasingly physicians rely on laboratory diagnoses. I always tell my residents that I regularly attend our own medical school's Morbidity and Mortality Conference. And at least half of the discussion every week revolves around imaging or laboratory results. Clinicians are utterly dependent on laboratory results today for care of many patients, especially patients who are acutely ill, critically ill patients, and even patients with chronic disorders like diabetes and heart failure. So we play a very important role in the overall scheme of healthcare today. And so it's really important that our laboratory results are reliable and accurate, and this is what we're about in the college, and this is what we're about in these programs like the CVL program.